count on more than one hand a situation where we're doing planning for a client who's in their maybe 20s, 30s, maybe their 40s.
Yep.
They're doing all the right things. They're saving, they're maxing out every vehicle that's available to them. They're very disciplined. And they have this goal of, it's not 65, it's 60, it's 50, it's 55, or it's as soon as possible. So the topic comes up, and it's, at least from what I've read, like next to your real estate costs and maybe, taxes, health insurance is one of the next biggest costs. Early retirement folks, or folks who are like, on that trajectory.
Yep.
What do they need to be thinking about if, they are wanting to retire by 40, 45, well in advance of age 65 Medicare?
You're exactly right. Whether it's 45, 50, 55, there's this early retiree segment. And so a lot of what we're going to talk about today specifically will kind of lean into maybe like the 50 to 64 window, because that's where we're seeing a majority of, folks that are wanting to retire earlier, kind of in this gap before Medicare, right? And so there are a lot of people, there are 40 million Americans between the ages of 55 and 64 that are saying, hey, Dylan, I followed your plan. I've saved diligently. I've done all the right things financially, but health insurance, right? My in-laws were 60 years old. They had followed their financial advisor's plan. They had worked with this financial advisor for 30 plus years, really long-term, good relationship. And right as soon as they hit retirement age, or when we're getting ready to pull the plug on retirement, their financial advisor said, hey, you need to be thinking about health insurance. He swung around a monitor and said, plan for $28,000 a year in health insurance costs. And, my father-in-law swung the monitor back. He said, hey, I don't hate my job that much. I'll just keep working. And he was prepared to work from 60 to 65 just because of health insurance costs. We know it's a big concern. There are some statistics that are out there, that 62% of Americans, this was from a nationwide, health insurance in retirement study, and it was 62% of Americans are terrified of what health insurance may do to their retirement plans. Is it going to derail their plans entirely? And then 60% of folks, just in general, don't understand their health insurance coverage. They don't understand how it works. They don't understand what a deductible or a copay, et cetera, is. So it's important to make certain that you're informed as you move into retirement of what your healthcare costs are actually going to be.
Can you tell us a little bit about like what that healthcare or health insurance option like marketplace looks like?
There are 5 main options in early retirement that we will talk about, right? So one is the Affordable Care Act marketplace. We'll dive in a little deeper on this specifically in a little while, but the Affordable Care Act marketplace, the Affordable Care Act was the biggest piece of healthcare legislation that was ever passed. It was passed in 2010 by President Barack Obama at that time. And then it created in 2014 this thing called the Health Insurance Marketplace. So you might hear marketplace coverage, things along those lines. And the unique thing about that is the marketplace, you can get, if you have a pre-existing condition, guess what? You can get coverage on the marketplace. You don't have to medically qualify for that coverage. Another option would be, off marketplace, right? So off marketplace would be health insurance coverage that acts like health insurance prior to the Affordable Care Act. So they'll ask you health insurance or health related questions. So things like your height, your weight, what prescription drugs do you take? What type of risk factors might you have? And so they're going to do underwriting and they'll base your premium off of that. So there's off marketplace options as well. Another one that's important to understand if it's available to you as a client is an employee of your job. You might have retiree health coverage options that are available to you through your employer.
Yes.
And so obviously your previous employer, I should say, at that stage. So there are some, instances where they will pay for your health insurance premiums up until you hit 65, right? Or even beyond, right? So that's retiree health coverage. It's not available to everybody. Check with your employer, check with your HR department to make certain there's not something. Typically, these are big organizations that have these plans. A fourth option would be healthcare sharing programs. And so these are, once again, not for everyone, unique arrow to have in the quiver. Typically, these have a faith-based component to them. They aren't subject to the Affordable Care Act guidelines. And most of the time, healthcare sharing programs are going to be something where they might act, walk, and talk like insurance, but they're actually members as a part of a membership that are actually sharing in each other's healthcare costs. And so these can be a cost-effective alternative. With any type of insurance or healthcare sharing program, it's really important to understand the unique pros and cons of each of those. The last one that we'll mention really quickly is Cobra, right? This isn't a snake. It's Cobra.
Cobra Kai.
Yeah, exactly. That's right. It's not a karate movie. Cobra was written into law in the 80s, and essentially what it allows you to do is continue your employer benefits. Now, what happens with Cobra, and anybody that's looked at what Cobra costs are, go, holy moly, these are expensive. And they go, okay, why is Cobra so expensive? Well, right now, as an employee of an organization, a W-2 employee, you typically, your employer is typically subsidizing a portion of your health insurance premium. They're saying, hey, we'll pay 70% or 80% or 90%, or some employers will pay 100% of your health insurance premiums. What happens when you take Cobra is all of that subsidy goes away. They stop subsidizing it, and they add a 2% administration fee. And so you're paying 102% of the full cost of your health insurance that you got.
Yes.
And so Cobra is typically really expensive. This would be an instance where somebody mid-year retires. Why would we say take Cobra? If you're retiring mid-year, you've already maxed a deductible for the year, hit your maximum out of pocket, you've used your healthcare plan. Sometimes the juice is worth the squeeze to pay those Cobra premiums and keep it throughout the remainder of the year. But the other thing about Cobra is you can only keep it most states for 18 months.